So we asked speech-language pathologists in an interview, to what extent is your rehab director knowledgeable about memory aids for residents with dementia? And the speech-language pathologist says, I don't know. He's pretty hands-off, so I do all of these things that I don't really think he knows that I do them. I don't think that he has any concept of the things that I'm putting in people's rooms or working with them on a daily basis. I think he's pretty hands-off. And then we went on to ask, to what extent does he support your use of these tools? And again, in this case, we are talking about memory aids for residents with dementia. And the speech-language pathologist says, yeah, well, I can't really, I think he's pretty, he gives a lot of leeway. I wouldn't say that I have either a lot of support, I wouldn't say that I don't have support. I would just say pretty neutral about it. And then I ask, well, what about other people in your building, like nursing managers, nursing assistants, the administrator, the DON? How much do you think they value your use of memory aids for residents with dementia? And this SLP says, I think they really like my ideas theoretically, but I think when it comes to kind of the trickle down of communication from maybe, let's say, the assistant director of nursing, and I really want to do this with this person, and maybe I even get a care plan that they need to do this. It seems like even with those things in place, then getting the communication to the various staff working with the patient is a challenge. Okay, so this kind of points also to more effective communication networks. Okay, so when you think about the informal one and the hierarchical one, perhaps there's some suggestions there with how we can improve communication. So maybe we are trying to advocate for the hire of another speech-language pathologist. Maybe we need some PRN help. Okay, so what we're doing in this, what you see in this slide is you see Ryan in the middle. Okay, and he is trying to communicate the value of speech-language pathology services. So what you see here is Ryan tells Hayden about it. Hayden tells Hannah. Hayden also tells Lainey, who tells Janet, Katie, and so on and so forth. So you see this mixing up of this informal communication network. Now on the other side, in contrast, you have more of a hierarchical communication network. So you've got Ryan again at the top, and he tells Hannah, Colette, Adam, and Elizabeth, but less people are getting the message, and the message is not spreading outward in the way that you would like. Okay, so if you take again a gander at this supportive informal communication network, okay, in contrast, you see this more hierarchical one. Okay, it's much more efficient to have a more informal communication network in communicating our value or whatever it is that we're trying to communicate as speech-language pathologists in skilled nursing facilities.